Good? Alright, so this is Archie. Archie, how old are you, buddy? You're 6 months old. He's a male Labradoodle, and he's here to get neutered. So the first thing that happens when they come in on their day of surgery is that we make sure that they haven't eaten in the last 12 hours because we want them to be on an empty stomach when they come in for surgery. Because sometimes when they eat beforehand, they can regurgitate when they wake up, and that can cause some problems. So we want to make sure their stomach is nice and empty. And then the technician will check them in and get a temperature, a pulse, a respiration, and a weight so that we can make sure that they're healthy enough to go under anesthesia. And we back that up by doing blood work, which we've already run. And we do that on every single patient that goes under anesthesia, no matter how old they are. And Archie's was all normal, which is good. So the next thing we're going to do is we're going to give him a quick exam the morning of his surgery to make sure that he's healthy. So we check their teeth. He's 6 months old, so he has all of his big boy teeth already. If he had any baby teeth left, we would pull them out, because sometimes these guys can keep their baby teeth, and if they're there at 6 months old, they shouldn't be, so we just pull them out while they're under anesthesia. I know, it's very sad, isn't it? We check his gum color. Nice and pink. Check his capillary refill time, how quickly his gums pink back up after we push on him. Should be less than 2 seconds, and it is. It means his blood pressure is good. Make sure he's nice and hydrated. Feel his lymph nodes. Feel his belly. And basically, we're just making sure that there is nothing weird going on that could complicate anesthesia. Anesthesia, basically what we're doing is we are giving them drugs to bring them as close to death as we can without actually killing them, and that's the truth. So we have to be down in the scrotum, which is good. It means they're easy to find. And then we're going to check his heart, make sure that he has a normal rhythm and no heart murmurs. That could make the anesthesia dangerous.
Oh yeah.
And his heart sounds fine. His lungs sound fine. He's perfectly healthy. So the next thing we'll do is one of the technicians will draw up his pre-medication, which is a sedative and a painkiller. We'll give that and we'll let that kick in for like 20-30 minutes, and then we'll put a catheter in, and then we can get him under anesthesia. All right, buddy? Go back in your cage.